My name is Robert Edelstein, and my PAE was done a little over 2 years ago. But before I talk about that, I'd like to give you a little history. I had a hip surgery done right before my PAE, and because they gave me a nerve block, and I've had that before, it caused voiding problems. And it happened again with this hip. So they told me to go home and I should have no problems, voiding and things. And unfortunately, that didn't happen. So that was my first visit to the ER, where they put in a Foley catheter. Then they had me go home. Then I went back, and they determined they'll take it out and see if, in fact, that was going to work. And it didn't. I had to go back to the emergency room again, and the catheter Foley was put in for the second time. Then they realized that it was a little bit more than just what they thought, and they determined it was a bacterial infection. They ran God knows how many tests on me, and finally realized that it wasn't that. And with that being said, I know my wife contacted Dr. Bagla, and we talked about having a PAE, and one of the things that sort of was like in the back of my mind was the trepidation of going through what I had to go through at the hospital. When I finally met with Dr. Bagla, he was really good at explaining exactly what this procedure was, went through every little detail, what I could expect, and that sort of put me in a relatively calm state of mind. He had determined that my urethra was pressing on my large prostate, and that was the problem. And after going over to see if in fact that I would be a candidate for the PAE procedure, he said I was. So I scheduled the procedure for about a week later. I came over to the office in Virginia, and the first thing I came in contact with was the staff, which was just as efficient as Dr. Bagla. They again went through all the nooks and crannies of what I was going to expect, and again, that put me at ease. The process, starting with entering the office and having somebody behind the desk greet me, knew my name, knew exactly what was going to be happening, is sometimes more the exception than the rule when it comes to like a customer service kind of thing. You sort of expect the worst, when you enter an office and all of a sudden you get those stares as if they have no idea what's going on. That was exactly the opposite when it came to Dr. Bagla's office. Again, one of his staff members sat down with me. We had an opportunity to talk. She calmed my nerves, and that experience sort of was the beginning of a larger experience of having the PAE. So from beginning to end, it was something that, for the most part, I would recommend, not necessarily because of the results, but also the way that you were treated. It was just professional in all aspects. And again, I was told that I was not going to have a transurethral resection, which is, as you know, going through the penis, which after a little bit of research, I noticed that a lot of people had mentioned that could cause some sexual, effects. It was really important that not be the case. Me feeling that I'm young enough that I can participate in that particular activity was important. It was important emotionally. It was important physically. It just, again, put me in a much more comfortable kind of position, knowing that my recovery was going to probably be a lot easier, and I wasn't going to have the after effects of not being able to perform like a normal 76-year-old does. I had the procedure, which, by the way, was absolutely painless. It was just not necessarily I don't want to have it every week, but it was just a lot better in every aspect. They asked me to, after the procedure, just to sit, to relax, and in about an hour to see if, in fact, that I could void. I went to the bathroom after about an hour, and lo and behold, I was able to void. It wasn't a steady stream kind of thing, but it was markedly better than what I'd had when I was in the hospital trying to go through all those tests. Like I'd mentioned, I had no sexual performance problems whatsoever. And as an aside, I also recommended 3 friends of mine who had the exact opposite problem, where they urinated often. They had the procedure with Dr. Bagla, and they again expressed their gratitude because it worked extremely well for them also. And as far as what happened going forward after the procedure, went home, and each day the flow became better and better. I've had absolutely no problems after the last 2 years. And when you're able to urinate better each day, that in itself is it's a wonderful outcome. And again, as an aside, and this is absolutely the truth, every time I went to the bathroom, I thought of Dr. Bagla. Now, I'm not quite sure why that was, and it was just nothing but a happy face as far as I was concerned. I couldn't be more satisfied with what Dr. Bagla and his procedure did for me.